Fox Focus, a few minutes for a closer look.
Today's focus is on lung cancer. It kills more men and women in the United States than any other type of cancer. As a matter of fact, in 2012, the American Cancer Society estimates that in Wisconsin alone, more than 4,000 people will be newly diagnosed with lung cancer. Joining us today is Dr. Patricia Thompson. She's a medical oncologist with the Cancer Treatment Centers of America. Dr. Thompson, thanks for being with us.
Thank you for having us.
Now, those numbers are alarming. Why is lung cancer so deadly?
First of all, there are more than 200,000 people diagnosed with lung cancer in the United States alone every year. So that number is alarming in itself. But most people are diagnosed at an advanced stage, so they're not curable at that stage. And fortunately, I wish we could diagnose people earlier. So that is what is alarming too.
Why are they diagnosed so late?
Because it takes quite a while sometimes for the lung cancer to manifest and have symptoms. So patients will look for a doctor to diagnose them.
And it's late at that point. What can we do? What can people do to help prevent lung cancer?
The number one cause of lung cancer is smoking. So the number one way to lower the risk of lung cancer would be to stop smoking. Now, that's not the only reason that they get lung cancer.
Can non-smokers get lung cancer?
Absolutely.
Okay.
About 15% of the patients that we see in the nation are non-smokers. And now lung cancer can be gotten by people that are secondhand smokers. Also, radon gas exposure can cause lung cancer, and other issues such as scarring in the lung and some other exposures to other chemicals or asbestos. Even though we say asbestos can cause mesothelioma, it can also cause lung cancer.
But really, the number one way to prevent it is the stopping of the smoking.
It's the stopping of the smoking.
All right. Now, what are the symptoms of lung cancer? You know, you say that it's caught so late and it's really hard to detect, I'd imagine. So what should people look for?
Some of the symptoms could be unexplained weight loss. Somebody that's not on a diet and it's losing weight very easily. Cough, shortness of breath, coughing up blood, hoarseness, chest pain.
Okay.
Those symptoms can be seen in lung cancer. It also can be seen in other problems, but in mainly lung cancer you'll see those.
And then make sure you're talking to your doctor there.
If you have symptoms that you're worried about, talk to your doctor.
Right. And what should you do if you're diagnosed with lung cancer? What are your options?
If you're diagnosed with lung cancer, the options would all depend on the kind of lung cancer and of the stage, how advanced it is. Some of the options include surgery, radiation, and/or chemotherapy, or a combination of those. At Cancer Treatment Centers, what we'll do is we'll meet with a group of experts, radiation oncologists and surgeons and oncologists, and we'll plan the management of that patient based on that patient's cancer and based on their stage. Also very important is once a patient is diagnosed, from the beginning is supportive care. And that has to do with mind-body and nutrition and the naturopath physician. So you need a whole team to treat the whole patient.
And that's your approach? Then you kind of take this integrative approach.
Correct.
With everybody, and you get that at Cancer Treatment Centers.
Correct.
Yeah. Okay.
And it makes a difference. And it's being proven. Data proves that too.
Okay, I want to make sure that everybody has the information they need. If you want to get a hold of Cancer Treatment Centers, the number's on your screen there. It's 1-800-851-4910. You can also go to their website at cancercenter.com. Dr. Patricia Thompson, great information, kind of grim statistics, but really good information. We thank you for being with us today.
Thank you.
Absolutely. We'll see you on the next Fox Focus.
Interested in appearing on Fox Focus? Email us at foxfocus@fox6now.com.